as a biomarker of their functional health. And so if they're getting more active, we'll assume that when that data comes back to a central monitoring site at that hospital, that those patients are doing probably pretty well. If we see that that activity is declining or is never picking up, then we worry about whether we need to modify their medical regimen and get them in before this changes. And finally, when we give drugs to patients, we don't know exactly what the effect of that drug is going to be. So if you have Parkinson's disease, for example, and you get a drug that increases dopamine in the brain, so that helps reduce the tremor and the pill rolling movements and the stiffness of gait. But the patient is doing that at home. And this is a disease that fluctuates hour to hour, day to day. We don't really know if we're hitting on the right dose throughout the day. Or there's certain times of the day where maybe a little more medication would be better than a little less. And other times of the day when they have side effects from the medication and maybe we should go down a little bit. The only thing I know is that someone shows up after 3 months and tells me what happened. And often they look great when they're out in front of me. I would like to know what they're doing at home so that the adjustments that we make can be real-world based. We also need to figure out better ways to provide feedback about how much and how well you're doing things. And this is a really important area because we have all this data and you accumulate diverse kinds of data and you want to do something with it. You're probably going to, in part, want to alter your management and convince the patient to do something that's different than what they're already doing, or convince them they really need to do something that you asked them to be doing. And you can easily see this for things like fitness or to manage